Night is not only for sleeping. A 56-year-old patient presents with abdominal pain. He has already received inpatient treatment for sigmoid diverticulitis. 2 weeks ago, he was discharged despite the pain, which has increased significantly again in the last 2 days. At the current examination, there is soft abdominal wall, but pressure pain in the lower abdomen, more to the right of the navel. The peristalsis is regular. In the laboratory, you find an increase in C-reactive protein and leukocytes. Here are the sonographic findings. You sonicate a sagittal or longitudinal section slightly to the right of the navel in the lower abdomen. The findings are shown here. I hope you can orient yourself and get a general idea, or at least make a presumptive diagnosis. What do you think? The longitudinal or sagittal section, slightly to the right of the midline in the lower abdomen, shows a small wall-thickened loop of bowel here. Peristalsis cannot be seen clearly. Again, this is where the loop of bowel comes in. This is where the slightly thickened wall starts. The stratification appears to be preserved. But we clearly see a surrounding reticular reaction, again. This is a normal wall, which is thicker here. The echo-rich submucosa, the echopore muscularis propria, the surrounding reticular reaction. And in this surrounding reticular reaction here, we see an echo-free area, an echo-free formation. Here again, a section of normal colon wall. Then, starting here, the thickened colon wall and the surrounding reticular reaction. And in this reticular reaction, there is the echo-free formation. This is the sigmoid colon. The sigmoid colon is somewhat thickened and, not atypical in adults, it runs in a loop from left to right. It does not always have to be in the left lower abdomen. Often it makes a small loop and also lies on the right. So, wall-thickened sigmoid, surrounding reticular reaction, and obstruction in the surrounding area. An inflammatory altered diverticulum is no longer clearly recognizable. Nevertheless, in view of the patient's anamnesis, we believe that it is probably a previous sigmoid diverticulitis, no longer fresh, but in this case with an obstruction or abscess in the vicinity. It was confirmed in the computer tomography. We have a section of the sigmoid and a pronounced reticular reaction. This is what normal fat looks like. Normal fat. Here we have inflammatory imbibed fatty tissue. And in this inflammatory imbibed fatty tissue, the fluid content. Here it continues with the wall-thickened sigmoid. You can also see how the sigmoid makes a large loop from the left lower abdomen into the right. Only then does it descend again deep into the small pelvis. With that, hopefully, your preliminary diagnosis of sigmoid diverticulitis with perforation or abscess is confirmed. We hope you enjoyed this little excursion. Thank you for your attention.